All right. Well, let's get started. So as I mentioned, my name is Alexis Shavy. I'm a senior academic advisor in the Class Advising Center. And I work with our pre-professional students, a lot of our science majors. This is the second session for our Getting Started workshop series. We had the Starting Your Professional Journey a couple weeks ago and focused more about what our office does, how we work with students, and a little bit about competencies. So kind of what goes into building a strong application in terms of different attributes that you're trying to develop. For this workshop, we're going to be focusing more on clinical experience and how to find those clinical experiences. But if you would like to get the recording for that first session, absolutely email me, and I'm happy to share that. One of the things we did talk about in our first session is our office works with a variety of pre-health students, but we really fit those into 7 different categories. So our students who want to go to medical school, dental school, vet school, pharmacy school, optometry, podiatry, and chiropractic. So if you're considering other healthcare fields, those are typically advised in another area of our university or may not necessarily fit into kind of the same guidelines that we have here. So what we're going to be talking about today is what is clinical experience, kind of trying to define it, make sure you understand different ways that you can go about, find ways that you can get the experience, and then kind of what it qualifies as clinical experience. What I'd like to do is, if you can, in the chat, if you can just answer that first question. If you had to define what clinical experience is, what would you say? I'll see if anybody responds to the question, but I'm happy to share. Perfect. Thank you so much. Appreciate it. Time spent shadowing a professional or working in a healthcare field. Those are 2 huge areas, definitely. Shadowing, employment, volunteering can also qualifies in there. Really, when we think about clinical experience, it is more hands-on, whether that be hands-on practice or maybe hands-on in the sense that you're observing a professional, but it's in the settings that they work in, really getting a better sense of what goes on in the field that you're aspiring to go into. And it's important for a couple of reasons. Healthcare fields that we're talking about are incredibly competitive. And so it's important that you have experience to show that you have the skills needed to be successful. It's also can be helpful to make sure that before you really commit to this career track, that you're aware of what's involved with it and that you know that it's a good fit for you. So both sides of it, making sure that you're developing right, and then also making sure that it's the field that you really want to go into. We can boil down clinical experience into kind of 5 different categories, which I have listed up here. Paid employment, volunteer work, shadowing, all of those were mentioned in the chat. I would also add in there informational interviews would be considered, and internships and practicum. So we'll talk about each of these individually, make sure you've got a good sense of what's involved with them. And I'll share some examples. I've been a pre-health advisor for quite a long time, and really try to get a good idea of where we have students getting this experience. So I'll share what some of our successful students have done in the past. Everybody put kind of work. So if you think about employment, work is probably the thing that comes to mind first. Great way to get the experience that you need and get the income that you may need as well to go along with it. Depending on the type of clinical experience you're doing, it might require some certifications or some training involved, but there are also a number of healthcare areas that you can get involved in without any experience at all. So I think it's important to know that wherever you're starting, there's a spot that you can be getting clinical experience. And paid employment is definitely going to be maybe one of the higher touch areas of patient care. And so for that reason, there's going to be extensive training involved. You're not going to do training in an afternoon and be ready to start taking care of patients in a clinical setting. So a lot of training involved, and there might even be a certain time commitment for the training, or a time commitment that they're looking for before they hire you on. Some different examples, kind of titles that we might see our pre-professional students working in. I think probably the most common is CNA, Certified Nurse Assistant, or Medical Assistant. We'll have students come in from high school who maybe already have some of these credentials and are already working in the field. A CNA and an MA can do maybe more things like passing medication, taking vitals, maybe more than an entry-level position can, but it's definitely not required that you have those certifications. If you're just starting out and you're looking at a place that you can get started, any type of position that has kind of a technician name is great to look for. Some examples would be like a nursing assistant. I know Trinity Health refers to their nursing assistants as patient care advocates, or PCAs. Pine Rest Mental Health Hospital in the area, they have similar positions they called psych technicians. So they work with people who are inpatient and need assistance. Patient aids, another term. What we're thinking that somebody does in that role could be helping patients with maybe feeding, bathing, toileting, dressing, patient care, things that you can do as somebody who cares for other people, and kind of providing that patient comfort, but not to the extent that maybe a medical assistant would do. Love the chat. Thank you for sharing that. EMT, I'm assuming everybody knows what an EMT does here, but what I wanted to highlight is that an EMT would be training that you would get maybe at a community college or maybe a private organization. There's one in the Grand Rapids area that provides kind of evening EMT classes, and then kind of the hours that you need to spend riding along to learn the job. But great for somebody who maybe thrives in high stress situations, or maybe is interested in getting into emergency medicine. Really great for somebody kind of with those personality traits. Medical scribe, I wanted to talk about a little bit more in depth because not everybody knows what a medical scribe does. We have a scribe academy at Grand Valley, but there are other ways to become a scribe. Scribes really sit in the maybe emergency room or in a specialty clinic, and they're listening to what those interactions are between the provider, maybe a physician or a physician assistant, and the patient, and kind of hearing what's going on and taking those notes. That frees up the provider to really be able to focus in on the patient. And one of the things that I had a previous medical student who is now in medical school, who was a scribe, said that the longer that they were a scribe, they could start to anticipate what kind of tests and labs that the physician might be ordering. And that became incredibly helpful when they started to do their clinical work in medical school. So I also describe it as kind of paid shadowing, because really you're supposed to be physician assistant or physician facing throughout your shift. Phlebotomist, as you can imagine, somebody who's drawing blood. I think one of the value of somebody who's a phlebotomist is that people are oftentimes stressed if they're getting maybe blood drawn, or kind of the things that a phlebotomist would do. So phlebotomists can be great at kind of with that patient care, developing trust, kind of easing anxieties. Phlebotomy work is maybe a little bit more short-term though. So that's one of the things that's different, where a CNA or a technician role might be a little bit more, you might work with patients for a longer period of time. Phlebotomists are usually in and out. So just kind of different skills with each role. A lot of these ones here that I've listed already are working with people, but it's important to note that regardless of your professional area, all of these are about building skills in a clinical setting. So it doesn't matter if you want to be a vet one day, but you have experience in a hospital, there are transferable skills from there. If you're working in an optometry office, but you want to be a dentist, again, transferable skills. A couple of these on the list here are specific to some of those other areas that I mentioned. So for vets, for pre-vet students, their goal is to try to get animal experience as well. So working in a vet office as a vet assistant, kennel tech is maybe like at a doggy daycare or even a groomer's kind of working with animals, being able to improve their animal handling experience. Dental assistants, depending on the dental assistant, they might have an extra certification where they can also do x-rays in a dental office, but usually a dental assistant is somebody who's maybe helping to room patients, sterilize equipment. Some of those dental students that I've worked with have also said that if they're in an office, dentists themselves might be really great at letting the dental assistants kind of practice on maybe some of the molds or some of the things that are extracted after a procedure, just to get some of that hands-on practice. And it's also great too, if you're in these settings, some dental assistants have said that they're welcome to come in and shadow different procedures. So there also could be a little bit of shadowing involved with it too. Pharmacy technicians are what you see when you go to the pharmacy, like a Family Fare or a Walgreens. Pharmacy technicians work side by side with pharmacists. They help fill prescriptions, work with insurance companies. So it's just a different way to get clinical experience. And pre-pharmacy is one of the areas that we work in. So our pre-pharmacy students are really lucky that they can have something very specific to the field that they're interested in. And then optometric technician would be kind of that technician role in an optometry office. A lot of times optometric technicians might be doing a little bit of work with equipment, taking patient history. And I also have kind of optician work on there, maybe helping patients pick out lenses or filling contact lens prescriptions too. So kind of a wide range of things. One of the things I wanted to show is how do those experiences translate on an actual application? So when you're applying to for your professional program, you will have a very limited space actually to talk about what you've done. So what I have pulled here, with the applicant's permission, we have a pre-med student who worked at an assisted living facility, and one of our pre-dental students who worked at Aspen Dental. Things that are important to keep track of while you're doing these experiences, length of employment, how many hours, and contact, who is your supervisor. So those are some of the basics. You also will see here that these are written in a different way than a resume is written. So a resume might just have bullet points of what you've done, focused more on job duties and responsibilities. Here, maybe a sentence or two is focused on job duty and responsibilities, but it's focused the later half of it, as it should, a little bit more reflective. Why was it important? What did that experience mean to the individual? One of the things I like most here, this applicant says, I also play a large role in creating a safe and trusting environment for the patient. This is accomplished by actively listening, open communication, providing a high level of care, by being compassionate and constantly advocating for the patient. So they're really showing how they go about creating a trusting environment. And this particular applicant also talked about that in their personal statement. So these are great examples of those things that you kind of want to note that you're learning along the way. And then we work with students all the time to kind of figure out, how do you fit this down into that character limit? That 600 characters with spaces is not a lot. So how do you get everything you learned in a couple of years boiled down to that? Okay, let's shift gears and talk about volunteering. I know you all know what volunteering is. A couple of things that are maybe extra to note. Extended volunteering is really important with getting clinical experience. Maybe you have, maybe like 1 day of service here or there already on your resume. But what we're looking for here is longevity with an organization, with a certain population, because what we're trying to strive for is building up your service orientation. Volunteering in a clinical setting can take a bit of time to set up. We've got noted here, there might be immunizations that you have to provide, background checks. They also might require a certain length of commitment. As you can imagine, you're going into settings where there's patient privacy that you have to be mindful of. And depending on the organization, they might have different needs, and they might be trying to match up the needs of the organization with the skills that the volunteers are bringing in. So it can take a little bit of time. I think it's great, since we're in the fall semester and you have your fall and winter here at Grand Valley, it's great to start looking for something like this. You definitely would have the amount of time that would help benefit an organization. It also can be helpful with volunteering to think about if you have time over summer break, to kind of spend some time. If you're not going to be in the Grand Rapids area, but you're going to maybe be in your hometown, you can spend some time getting that set up so that you can kind of utilize May, June, July, a little bit of August to do some of the volunteering. I wanted to share some specific examples of where we've had students do volunteering and where they did. Here I have just kind of a general list, so you can think of some places that you might automatically think of, like a hospital that does volunteering, some of our free and low-cost clinics. But on the next slide here, I really tried to pull where some specific organizations where we've had students volunteer. And I wanted to share a couple of those with you. So in Grand Rapids, we have kind of three major hospital systems: Corewell, University of Michigan West, and Trinity. And some examples of that would be in the emergency room. I know Corewell uses volunteers to help. The volunteer might go into a room, maybe see if somebody needs help, maybe turning the TV on, getting something to drink, a warm blanket, maybe stocking shelves. So work that you can imagine isn't terribly intensive, but it's necessary for the patient experience, and it's something that you could easily do without a whole lot of training. Child Life volunteer, Helen DeVos, which is part of Corewell. Helen DeVos uses Child Life volunteers to go in and help make procedures maybe a little less scary for kids or kids who are staying in the hospital, kind of provide a little bit of relief from what the situation would be. So they use Child Life volunteers in that setting. I was going to point out Oasis of Hope is a free and low-cost clinic, as is Exalta Health, free low-cost clinics in downtown Grand Rapids. Exalta Health uses volunteers. They have a dental clinic, so they will use volunteers to provide as dental assistants, and they'll kind of teach you what you need to do. Cherry Street Health is also a free and low-cost clinic. Both Exalta and Cherry Street in the past have needed volunteers who can be interpreters. So if you are proficient in another language, that's a great way to also provide a service to an organization and kind of get some experience, but also helping out. Going to jump back up here to hospice. This isn't one that everybody, a lot of students always think of, but hospice organizations need volunteers who can commit to maybe 3 to 6 months so that they can sit with somebody who's getting end-of-life care. There are a number of stories that I've heard from our pre-professional students who have done this. Sometimes they talk about just going and sitting with somebody who maybe can't talk, maybe is sleeping, maybe they're just sitting there and kind of reading to them or maybe holding their hand. Other times it might be that the person doesn't have a lot of family, but they're somebody who can show up week to week and just provide companionship, chat with them, play games, just kind of ease their experience a little bit. On the other side here, a couple of them I wanted to point out. Children's Healing Center is a location in Grand Rapids. They provide respite to caregivers who take care of children who are immune compromised and can't necessarily go to other play areas for obvious reasons. So they use their volunteers to be able to provide a safe place for immune compromised children, and then that provides that respite for their caregivers. A couple of these other ones here are not specifically in healthcare settings, but Crash's Landing is an animal, specifically cat shelter in Grand Rapids. And they also have a specific cat sanctuary for cats who have feline AIDS and feline leukemia. So it's a great experience for our pre-vet students who might be looking for getting some experience with animals that might have special needs. Maybe they need shots or medications, so maybe a little bit more intensive care there. I will also point out AmeriCorps and Peace Corps, Project Horseshoe. Those are examples of things that you can do in a gap year setting. So most of what I talked about would be local to Grand Valley, and places that you can go to on site. But if you are a student who graduates and you're still working on developing your application, you can do more intensive service programs that are not bound to the Grand Rapids area. AmeriCorps is one. I did an AmeriCorps program that happened to be with Habitat for Humanity, but it located me in another state for a year, and I did service in that organization. And there's a number of AmeriCorps programs that are healthcare focused, but that would be in the United States, whereas Peace Corps would be international and a little bit more of a longer time commitment. Project Horseshoe is another example of that. They work in the southern states and do a little bit more kind of public health, diabetes management, but they use volunteers to run their program. And I also have down here, be creative, thinking about where there might be a need in your community and kind of finding a way to meet that need is another example. I had a pre-vet student a couple of years ago who was a vet assistant, felt comfortable taking care of animals who had more medical needs, and they created a pet sitting organization. So they kind of advertised their services for people who had pets that had extra needs, and they took care of them that way. So those are all things that can go in an application, all ways that you can show that you're interested in helping those around you. Let's talk about job shadowing. In the chat, somebody had mentioned shadowing, and I do want to share a resource here. I'm going to drop this into the chat. It is important to have a certain amount of activities that are provider facing. So whether you're going into optometry or pharmacy or vet, you want to make sure that you can clearly articulate on your professional school application why you're interested in that field and what you know about the field. When we are reviewing, our office is reviewing applications and we're reading personal statements. One of the biggest critiques that we'll give is that we're reading about the field that you're interested in, and it's not specific, right? We could read that you're interested in helping other people and you have an interest in science, and the field of choice kind of combines those. That could be said for a lot of different professions. So the more that you can see what people do in the field of interest can help strengthen the application. Some professions that you're going into might have a certain number of hours that are required. I think of our dental students. University of Michigan requires 100 hours of general practice dentistry for the application. Whereas medical schools don't usually require a certain number of hours, but it's an activity that you can put on your application and that can help strengthen it. So it's really important to be mindful of what programs you plan to apply to, and it might vary from school to school, and you want to make sure that you're meeting those requirements. But ultimately, we want everybody to have some shadowing experience, and it can really enhance your application too if you get to the point where you have a pretty good relationship with a professional who might offer to either mentor you or maybe even write a letter of recommendation in the future. So it's important to start some of this a little early. What I had put in the chat was a guide from VCU, kind of how to set up your healthcare experience shadowing, and kind of questions to ask and things to do after the shadowing experience too. Informational interviews. I wanted to talk about, we saw an increase of students doing informational interviews, especially during COVID when it was maybe more difficult to get into a healthcare setting and doing shadowing. But this also can be a great way to maybe get hard to access positions. I think of psychiatry is the one that comes to mind. If you're somebody who's interested in getting into psychiatry, you're not going to necessarily be able to shadow a session between a patient and a psychiatrist. Not always, but it's more challenging to get. So an informational interview might be a way that you can at least talk to a psychiatrist and you can hear a little bit more about what they do and kind of find out more about like their day-to-day experience through that. So these are a little bit more casual. It also can be a great way if maybe you know somebody in kind of your inner circle, but maybe they aren't local. So it's easy to maybe set up a phone call or a Zoom chat or Zoom with them and be able to talk about what they do. Yes, I'm saying somebody put in the chat too, if you, depending on where you work, it also can make it a lot easier to do internal shadowing. The hospitals are a great example of that. Usually the bigger the system, the more challenging it can be to have access into it. So if you're already an employee, you've already done some of the things that you need, like immunizations and background checks. So it might be a little bit easier to get in and do some shadowing. Okay, and then last area that we're going to talk about here before we talk about how to get this experience is internships. Some programs at Grand Valley, like nursing, for instance, or some of our other College of Health Professions programs might have internships or clinical experiences already built in. Nursing students, for example, they have their clinical rotations in different healthcare settings. You might also have a major that does not require it, or they might give the option to a student. So for our pre-professional students, they tend to be in majors that do not have a required internship. But I wanted to give you some examples of what that might look like. It could be paid, it could not be paid. Sometimes depending on the organization, they may not require that it be for academic credit. Maybe the experience itself, they title it as an internship, but you might not have to go through all the steps to pay for tuition and have it count for credit. This is one I usually recommend that you talk with your academic advisor and see if there's room for this, if this is something that you should be looking into. And what I have on screen here is where we've had some of our biomedical science students do internships. Charles River, the top two there are research programs. So Van Andel's local, Charles River is not too far away, about an hour over in Portage, and they're a clinical research trial company. So they might hire interns for the summer to kind of work alongside researchers and learn kind of a little bit more of what's involved with the research side. We've also had students do some things in public health programs. So I've got an example in there, like a WIC program. Maybe it's not, you're not doing patient care, but you're working with individuals with a little bit of a health focus. So just kind of a couple of examples there. I also have Michigan, MSU's Rural Internship Program on there. Michigan State's medical school has a program for a couple of weeks in the summer. If somebody's interested in working in a rural healthcare setting, you actually, the focus is on what's needed to provide care in rural settings. And they actually go to more remote or rural areas. So there's a lot of examples there. I'm trying to think if there's anything else I haven't talked about with that. Biggest thing I usually say is if you don't need it for actual academic credit, always take the opportunity. But if you can save yourself a little bit of cost, that's the way that I usually recommend. So that's where your advisor can kind of answer that more specifically to you. So, okay, now that we've talked about what all the different areas are to get clinical experience, a little bit about how that might look on the application, I wanted to share a little bit more about how you might go about getting started with it. So I have on this slide here some ways to do employment and volunteering. One of the best things always is think about your inner circle. Who do you know who might already have connections? If you have, say, a family member or a friend, or maybe you, common one is if you work at a place like a golf course where maybe you're interacting with people all the time, tell people what you're interested in. Tell them that you're aspiring med student or that you're a pre-dental student. A lot of times people are willing to help, or if they know of an opportunity that might benefit you, they're willing to share that. So definitely tap into those personal connections. I also recommend in any time that you're interacting in these facilities, if you bring in your animal to a vet office, make sure you tell the veterinarian that you're interested. When I go to my dentist, when I go to my optometrist, I usually tell them I'm a pre-health advisor and usually see, do they have any job openings? Do they have any room for our students? So definitely make sure that you're talking with other people, and some of that networking can help. Career Center is also a great place on campus. Career Center, oftentimes people will think about, well, that's the place that I go when I'm thinking about my full-time job. Career Center can be a place where you are starting to get some ideas for entry-level clinical experience right from the get-go. They have, anytime an organization or a company is looking to hire or post an internship, it goes through a program we call Handshake, and you can create a profile on Handshake. You can create a job feed on Handshake so that you get those notifications. Career fair and events. We've got the big career fair coming up next week. And then there's another one again in February. So every semester, the Career Center hosts this big career and internship fair. A lot of healthcare organizations will be there to promote their either paid employment or internships. That's a great way to start networking too. Career Center also does these employer showcases. So kind of describe them as like little mini events. They might have somebody who's coming to campus. Let's see if we can see what's on here. Coming to campus for a specific date. And maybe that's something that you're interested in. You can stop by and hear a little bit more. So let's see, one that we just had. Oh, I mentioned Psych Techs at Pine Rest. So in November, Pine Rest will be here to talk about positions. We just had Sunset Senior Communities, which is, they're located in Allendale, very close by. Olivia's Gift is an organization that provides an independent home setting for adults with disabilities. So just a couple of examples of what might kind of be coming through the Career Center this semester. We also have, Career Center does a Getting Clinical Experience panel, and this is on November 12th. It's a little different than this workshop, where this workshop we're kind of talking about different ideas. That workshop, they actually are bringing the employers to campus. So there might be 6 to 12 employers who are actually looking to hire Grand Valley students for entry level care positions. Other thing I was going to mention here, when you talk to your advisor and your mentor, that kind of goes back into some of that networking. Let people know what you're wanting to do. If I know of an opportunity out there and it seems like a good fit for a student that I'm advising, I'm quick to share that. Same thing with your faculty mentors. On the class, I'm going to pull this one up here. On our pre-professional website, we have down here our healthcare volunteer and experience link. And we try to keep this up to date with different things that we know our successful pre-professional students have done. There's a little bit of a summary of some of those things that I talked about. What I really wanted to hone in on here is this table down below. So if you are looking for clinical experience, you could type that in. We have all the different keywords that things are organized by at the top here. If you wanted that clinical experience to be paid, we can filter that down. And there we go. We have a list of places that we know have hired Grand Valley students. If you knew you wanted to maybe do volunteering, let's say you wanted to work with kids, we can filter this down and you can see a variety of places where there's some volunteering experience. I will provide all of these links in an email afterwards. So I'll provide all this information too. I wanted to also talk about service clubs. So Grand Valley has a number of student organizations on campus, like the American Red Cross Club, Helping Hands Club. Those are great places to get volunteering as well. I usually say they're great because they're coordinated for you. If you're a member of the club, you just need to show up. I think one of the clubs I know is doing, I don't know if it's Friday Night Lights, but essentially at the Children's Hospital, people will gather outside with flashlights and kind of make it fun for the kids who are maybe going to bed and have to stay the night in the hospital. That's an example of something that I know our Helping Hands Club has done. The Red Cross Club, they'll coordinate blood drives on campus. So definitely think about, sometimes those are a little bit more accessible for someone who's just looking to get started. That's a great way to do that too. Grand Valley also has our civic engagement office. If you go to civic engagement at GVSU, any organizations that contact the university for volunteer experiences, they will post them on their volunteer feed. So those are a couple places to get specific volunteering work. And then I want to talk about how to get shadowing and informational interviews. So I mentioned like your tapping into your inner circle is one of the best. I definitely recommend doing that. If you want, if you're pre-med and you want to become a doctor and you're trying to get some shadowing experience, I recommend talk to your own provider. Let them know that you want to go. If you have family members who maybe see specialty doctors, ask if, hey, can you ask and see if they would let me do any shadowing? So be comfortable doing that. I also have on here cold calling. A lot of times for the smaller places, like think private practice, optometry office, dental office, vet office, it is perfectly acceptable to call and ask to speak to somebody who coordinates the shadowing. Let them know that you're a Grand Valley student who is looking to shadow. One of the quotes that I have here is from a pre-dental student who a couple of years ago, she contacted 25 different dental offices before she actually got a yes. And she said, you know what, if I had to contact 26 or 30, I would have. It just happened to be, the 25th place I called gave me a yes. So it's important to note there's a little bit of persistence is needed. It takes a while to get these set up. So don't be discouraged from that. Other thing in here I wanted to point out is our shadowing opportunities. So on our class advising website, go back here, we also have a link here for shadowing opportunities. And we try to keep track of where places are that we have been contacted. Maybe they'll say, I'm happy to have students come in and shadow. So this is organized at the bottom here by profession. It's kind of nice. One of these here I'll point out for optometry. The national organization that coordinates optometry programs has created this eye-opener mentor program. So if you're an optometry student and you want to know more about optometry, you can actually contact the organization and they will set it up for you. Same thing, podiatry has that as well. The Doctor of Podiatric Medicine Network, they have a mentoring program built in. But some of these others, if you're interested in pharmacy, Dr. Schiltz is one of the faculty who teaches at Ferris's pharmacy program. He's a clinical pharmacist, and he is happy to sit down and talk to people about what he does, and happy to have them come in and shadow and see what he does in the hospital. So definitely use that list as well. I would say any clubs that you're involved in, student organizations where they might bring in a panel of dentists or vets to talk about what they do, be willing to go up and talk with them, see if you can get their contact information or ask if they allow shadowing. LinkedIn is a way that our Career Center actually recommends reaching out. There's a long, extensive Grand Valley network in LinkedIn, and you can search what people are doing. You might be able to easily find people who are doing residencies or have worked in the field for a long time just by utilizing LinkedIn. I often will say for that, or even using Handshake, that's where you can stop into the Career Center Lab, and kind of get help with that. Last thing I'll point out here is the snowball method. So I think once you have a successful shadowing experience, it's always important to say, is it possible for me to come back another day? Or do you have another colleague that you think might be willing to let me shadow? So it goes back to kind of that networking that is important to do, and just kind of ask and see if that's something that they would be willing to help with. There was a question in the chat here. Is clinical shadowing and volunteering from high school relevant to med school apps? Great question. I am going to say for all of the professional areas that we work with, the general rule, with the exception of vet school, I'll talk about that in a sec. Usually anything that you've done in high school, you do not want to have listed on as an experience on your application. So if you did extensive volunteering or maybe some sort of shadowing program in high school and you're going on to med school, that experience might show up somehow in your personal statement, or you might use that experience to maybe get some more current experience. But whatever you did in high school, professional school, say that's what got you into college. It's the experiences that you do after high school graduation that are going to get you into professional school. Vet school is different. Vet school says if you have animal experience that extends back to high school, that's perfectly fine to put on there. So just kind of a difference in professions. Another question is there a general recommended amount of volunteer or clinical experiences for med school apps? There is not a specific number. And I say that usually comes up when any Q&A session I've been with for med school admissions. They usually will say, if we say a number, everybody's going to aim for that. There are a couple general guidelines that I do share, though. Usually by the time that you're applying, you want to have about a year's worth of clinical experience. And that could be between paid or volunteer work. Unless a professional program has a specific number of shadowing, I would say maybe 50 to 75 hours is a good target. Dental is more. We usually say 100 for dental. And then volunteer experience, there's a difference too between clinical volunteering and non-clinical volunteering. So it's also important to have service experience that is not helping you gain healthcare experience at all. So maybe a combination of those, maybe about 500 or so hours. In fact, one of the things I'll jump to here is getting your hours. It's really important to start getting your experience from the first year. You kind of wait to get experience until your sophomore year, you're kind of maybe crunching the amount of time that you have to build up those numbers for an application. Whereas if you start now, you can kind of space those out. I would also say too, we have 4 years up on the slide, but I think it's important to go with the pace that you're comfortable with. If you feel like your focus right now needs to be on school and you're in your first year and you don't have the capacity to take on more, that's okay. You also don't need to be applying to professional programs during your senior year. It's very common for all of the areas we work with to see a student maybe take a gap year if they need more time. So this is just an idea that you want to make sure you're tracking things as you do them, hopefully not waiting a year before you're planning to apply to get started with any of this. On the previous slide, I mentioned professionalism. I think it's just important to know that when you show up to shadowing experiences and such, you're reflecting Grand Valley, but usually making a good first impression is going to open up more doors. So if you show up and you're engaged and you're showing that you want to be there, when you make that ask anybody else that I could shadow, they're probably more those names. Or sometimes they might have employment opportunities too. And so as shadowing experience could also be a low-key kind of interview and maybe can also turn into an employment position. Okay, just a couple of things as we wrap up here. Tracking your experience. If you came to our first sessions, we talked about our action plan. That QR code will take you to the action plan. However you decide to track your experiences, if you're getting some of these clinical experiences or involved with other activities, it's just important to know what you do, the hours that you do them, and why they're important. And so some of those things on our action plan are set up to just have you be able to fill those in at your leisure. Also wanted to point out a couple upcoming events. Some of them I alluded to earlier. The career fair is coming up on October 9th, and that's downtown, not DeVos on the Pew campus, but the big convention center that's downtown Grand Rapids. And also the healthcare experience panel I mentioned the Career Center does. All of these events, if you use that QR code, it'll take you to our class advising calendar, and all of these things are linked on there. Michigan Medical Education Day is specifically for our pre-med students. That's happening at the end of the month. That's a virtual event that's put on by our Michigan medical schools. They'll do a case study, an admissions director panel, and a med student panel. So great way to kind of hear from some people who have either been doing this a long time or are doing it right now, kind of get their perspective. And then Michigan State College of Human Medicine is doing a lecture series in partnership with us in November. And I believe it's a pediatrician who will be coming and talking about adverse childhood experiences and kind of primary care. Okay, so while we wrap things up, just put a plug out here. After we do a couple more of our clinical experience workshops, we will be getting into our next session, which is about building your GPA. We'll talk more about kind of the academic side of things, transcripts, GPA targets that set an applicant up to be competitive. We'll start introducing the entrance exams. So specifically for our med students, that's the MCAT. Optometry students take the OAT, and dental students take the DAT. So that QR code will take you to those signups. And then lastly, we've got our contact information there for our office and a link to our survey. I'm going to go ahead and just stop the recording.